What is informatics? Our text defines it as the science and art of turning data into information. It is also defined as the science of how to use data, information, and knowledge to improve human health and the delivery of healthcare services. The University of Washington School of Information defines it as the study and practice of creating, storing, finding, manipulating, and sharing information. Components of healthcare informatics. Healthcare informatics is a broad-based, interdisciplinary career field. The first component is Health Information Technology, or HIT. It is an important component of healthcare informatics. It provides for the efficient and secure sharing of medical information among patients, healthcare providers, insurers, and others who have a legitimate interest in the patient's health. HIT can help to improve patient care by providing physicians and other professionals with timely, accurate, and complete medical records. This information can reduce or eliminate redundancy of testing, help avoid adverse drug reactions, improve the likelihood of early diagnosis, and improve the quality of decision-making by both the healthcare provider and the patient. The second component is Health Information Administration. This involves the combination of business administration with computer technology and medical record keeping. This component of healthcare informatics involves a broad and diversified range of studies, which may include clinical record keeping, patient data management and analysis, health information service, insurance analysis, and medical coding and compliance. The last component is clinical informatics. This component of healthcare informatics seeks to merge technical, research, and medical skills with computer science in order to facilitate the use of computer technology in solving healthcare problems. Individuals involved in clinical informatics are able to apply their expertise in biomedical informatics to other healthcare domains. They are also able to apply their skills in computer problem solving to medical issues. This component is typically made up of healthcare professionals who are trained and proficient in information technology and information technology professionals who are interested in healthcare management and administration. History of informatics. In the late 1950s, Harriet Worley was the first designated nurse researcher at the Walter Reed Army Research Institute. She was one of a handful of people asked by IBM to provide consultation about possible uses of computers in healthcare. In the 1960s, Worley convinced the American Nurses Association to include a focus on nurses' use of information in communication and decision-making. There is evidence of nursing involvement in the 1960s when a nurse in the USA developed an obstetrical computer-assisted instruction nursing simulation exercise to teach obstetrical nursing. In the 1970s, the phrase informatics was coined from the French term informatique to refer to the computer milieu. The first reports of computer applications in nursing began to appear in the professional and scholarly literature. Standard care plans that were developed to be modified according to individual patient needs were forerunners of today's evidence-based protocols and pathways. Virginia Saba and Goldie Levinson conducted the first national conference and several state-of-the-art workshops on computerized management information systems for community health agencies. By the late 1970s, the Journal of Nursing Administration featured a monthly column on computer applications in nursing. In the 1980s, the term nursing informatics was originated by Scholes and Barber. Nursing informatics gained much momentum in the 1980s. The introduction of the personal computer in 1980 facilitated small-scale prototyping of nursing informatics applications. In 1982, the International Medical Informatics Association, or IMIA, sponsored the first of its triennial conferences in nursing informatics. In 1988, the University of Maryland opened the first graduate education program in nursing informatics. Also in 1988, the National League for Nursing recommended that computer technology should become an integral part of nursing education and proposed it as a requirement for the accreditation of educational programs at schools of nursing. In 1989, Judith Graves and Sheila Corcoran published a seminal paper defining nursing informatics as a scientific discipline uniting nursing science, information science, and computer science to manage and process nursing data, information, and knowledge in support of nursing practice. The 1990s. The technological advances of the 1990s were remarkable. The Internet was introduced, which enabled communication and collaboration across distances, and the emergence of web-based applications made it possible to transfer health information across previously incompatible hardware and software platforms. In 1990, the American Medical Informatics Association was founded. In 1992, nursing informatics is approved as a nursing specialty by the American Nurses Association. The 2000s. In 2004, the National Library of Medicine licensed SNOMED CT for use by any healthcare organization in the United States and began to integrate SNOMED reference technology with the Unified Medical Language System. Also in 2004, President George W. Bush called for every American to have an electronic health record by 2014. Tomorrow's nurses must acquire the wisdom to use data, information, knowledge, and the technologies that support them to transform nursing practice and healthcare systems. Informatics will be getting bigger and better and will become capable of processing data more quickly than even the great speed at which it does now. What is infrastructure? Infrastructure is the basic and usually permanent framework which supports a superstructure and is supported by a substructure. Who works in an informatics department? The Chief Nursing Officer. This is a master's or PhD prepared nurse with extensive education and training in informatics. Their role includes planning, policy, budget, security, recruitment and retention, and day-to-day management of the department. This person may have various formal titles depending on their organization. The CNIO may report directly to the Chief Nursing Officer or the Chief Information Officer. Should they report to the Chief Nursing Officer, there need to be specific avenues in place to align with non-nursing units, for example, pharmacy or the lab. The Informatics Nurse. This is a nurse with advanced training in information management. These nurses tend to be highly skilled at understanding clinical workflows, and this transitions nicely to conducting clinical workflow requirements analysis for an EHR build and implementation, according to clinical innovation. The Informatics Nurse Specialist. This nurse is responsible for conducting research and gathering theory. Not directly employed within the informatics department, we must also recognize super users. These are staff nurses with extra training on a new implementation. This is the person at your elbow on go-live weeks. Also are staff nurses. These are the primary end users, especially of the EHR. Clinical nurses have the most to gain from a strong informatics department using evidence-based practice. EHR improves and accelerates timely patient care and documentation. What are the tools used? Hardware includes mainframes, media, cables, lines and routers, storage devices, and monitors. Software includes operating systems, interfaces, applications, and large-scale programs for electronic medical records, such as Allscripts, Cerner, or NextGen. Healthcare informatics integrates data to help understand patient outcomes, supports clinical decision support and evidence-based medicine, focuses on patient safety, provides nursing education, and gains a better understanding of the population being served. Evidence-based practice must facilitate building of evidence both to and from clinical practice. There are 5 building blocks for evidence-based practice. They are standardized terminologies and structure, digital sources of evidence, standards that facilitate healthcare data exchange among heterogeneous systems, informatics processes that support the acquisition and application of evidence to a specific clinical situation, and informatics competencies. How do all the parts come together? The EHR has little meaning beyond data capture and retention. Care cannot be readily coordinated or outcomes trended to support accountable care, and sufficient data to make correct comparisons between therapeutic modalities cannot be gathered or analyzed. In other words, nurses who can use computer hardware, software, terminology, and operating systems will be able to harness the power and efficiency of computer systems in enhancing care delivery and shaping nursing practice.